have three very important partners who provides us the information we need to help our advocacy. The very first is the Institute of Human Genetics, and at the time we were formed, Dr. Carmencita Padilla was the director, and actually the organization was formed upon her initiative. There are only 8 geneticists in the Philippines, no? And we are very lucky to have a very solid and dedicated team of medical specialists to help us. We take care of the non-medical concerns of patients. The second partner is the biopharma, and they have been supporting us not only providing the treatment on compassionate use, but they have also provided us worldwide information, which is very helpful for us in our endeavor now to pass a bill and touch our other policymakers. And the third is, I would think, my staff. No, in any organization, there is a turnover, and of course we have had turnovers, but the ones that we have now, they're totally dedicated. I think you've met one of them, and I couldn't do my job without her. And the other one is we have formed parent support group, because as you know, we have about 55 rare disease, and we have 7 patient groups headed by a parent, no, to help us in communicating our programs and coordinating with the parents. Without them, our programs will not move. First, through the help of the biopharma, we were able to put the data together worldwide to show the policymakers, hey, it's not only a whim in the Philippines, but many, many countries now, even among our region, even those that are within our same economic level, are already talking about it. And please hurry up, otherwise we'll be left behind again, no? And so that helped. And second, it's so difficult to get appointment with the lawmakers. So what we did is we called for an orientation among the legislative staff, because they're the first one who will endorse it. And that proved to be very helpful. It was followed up by one-on-one visit to the sponsors. This conference of yours made us think that this is about time to document the framework or the template of the information you can gather from your linkages, no? So that when we have need for staffing or restaffing, at least there is a guideline. But you see, it takes a lot of work. Somebody has to concentrate on it and do it uninterruptedly. And maybe this is one of the volunteer job that we can tap. No? There are volunteer youth leaders for health who are taking up health courses, and they may need a summer job. No? And hopefully they can be our staff later on when they graduate. Increase the range of rare disease. I think we need to touch base now for the other pharmaceutical companies, even if they don't have presence here for the medicine, but at least, when they develop the medicine, they had these diseases in mind, and maybe they can share the information so that we can impart this to the families, because sometimes the doctors don't have time to sit down hours to explain the disease, no? And so with that, they come to us and they say, where can I get help? And so, well, what is the scenario, what it looks like. You will need this, and these are the people who are available. And the third problem that it's not a problem, but the challenges is how to set up a donor management system. In the context of the need of our patients we're in, we need lifelong and sustainable and continuous support where the government cannot handle it all. We realize that we do need the private sector, okay? And right now, we notice that the orientation of donors is that I give one thing and hanggang doon, and sometimes it's not renewable because they look for other advocacies. No? They want to spread their wings. No? So we think that information again is important, wherein after donating for the first time, we have to give them progress report of our patients, show them pictures, let them meet them face to face, see how they have changed their lives, no? And hopefully they can commit, because they will be satisfied with what happened. They can commit maybe 2 years of X amount a year, and hopefully it can reach to 3 years and 5 years. Well, rare disease can happen to anyone, regardless of class, at any time. Even if it's not, you don't have any hereditary, it can start with your child, no? So we need everybody's help to support the bill, so that there is assurance that if unfortunately this happens to them, they know that there is support available.